Hey, thank you, Mr. Chairman. Welcome to the witnesses. It's the third committee this Congress, third committee hearing this Congress on the subject, and we finally have the largest PBMs here at the table. Thank you for joining us. Patients say that some of your practices are making it more difficult and more expensive to access the medication that they need, and so we need to hear from you about what's going on. The three companies represented today account for 80% of the PBM market, which means that the three of you sitting here are responsible for the policies and practices that directly affect the lives and the health and the pocketbooks of 270 million people in America, most of whom are not even aware that your companies exist. People don't choose their PBMs. People do choose a health insurance plan, which in turn has a PBM. Most people are offered a choice between a small number of health insurance plans, and then they wade through somewhat confusing language and murky distinctions to find the one that they think is best suited to the needs of their family. Nobody is thinking about the PBM that accompanies the health plan they use. In fact, most people don't even know that the health plan they're selecting is going to be working with a PBM. No one is considering the health insurance plan that they spend hours trying to select is closely affected not just by, not just by the insurance company, but also by another enormous business looking to profit. Although PBMs operate way outside of public consciousness, your companies have immense power over patients. PBMs create the list of medications that determine what will and won't be covered by an insurance plan. They determine how much those medications will cost, and they determine which pharmacies a patient can or cannot use to access the medications. Your three companies are dictating these terms for 4 out of 5 people in our country. And I'm glad you're here with us today to provide serious, robust insight into these decisions. While we don't have a lot of visibility into the inner workings of PBMs, the work this committee's done on PBMs this Congress has provided many examples of how your policies are not necessarily always working for the people that are served. The New York Times recently reported that one of your companies was charging patients on Medicare more than $650 for a medication that would have cost less than $50 at an online pharmacy without any insurance at all. A different patient was reportedly charged $211 by one of your companies for a drug he could have acquired at Costco for $22. That's a 10-to-1 ratio between what people are paying through the PBMs versus what they could get in just an out-of-pocket purchase. Who do these policies benefit? Well, obviously not the patients. It seems they benefit the PBMs, which get reimbursed by the health insurer for that higher price. Even if this system works for some patients, it's clear that many served by your companies are falling through the cracks, whether they experience delays in getting the medicine they need or they're forced to overpay. In a for-profit healthcare system, we know companies are going to seek profits, but it's unacceptable for those profits to come at the expense of patients getting the basic medicine that they need to lead their full and healthy lives. Democrats on the committee have long worked to hold Big Pharma accountable for the ways in which they relentlessly manipulate the price of medications and make them unaffordable for tens of millions of Americans. Our 3-year investigation revealed that pharmaceuticals use anti-competitive tactics to stop generics from entering the market and to target the U.S. for high prices because our government simply did not have the power to directly negotiate with them the way that our peer countries do. But last Congress, Democrats passed the Inflation Reduction Act, and the wins from that landmark legislation are already being felt. Beginning next year, Medicare will negotiate drug pricing directly with the pharmaceuticals, and drug companies will now have to reimburse the government when they raise prices beyond the rate of inflation. But we have a long way to go to place people over profits, to put healthcare first. I hope that today's hearing can shed light on the way that PBMs are taking a page from Big Pharma's practices and exacerbating the drug affordability crisis. We need a healthcare system that is going to work for the people. Thank you, Mr. Chairman, and I yield back.